Breaking this morning, Health and Human Services Secretary Robert F. Kennedy Jr. announced plans to cut 10,000 full-time employees from the agency. Another 10,000 HHS employees have opted to leave the agency since President Trump took office. According to a release from the agency, this is going to be shrinking the agency's full-time employees from 82,000 to 62,000.
You'll have to remember that the federal government, the White House has told every federal agency to start building these reorganization and restructuring plans to create plans for a reduction in workforce. And this is just part of what the Department of Health and Human Services is going to be doing. They say that it will save about $1.8 billion in taxpayer dollars as a result of this reduction in the workforce that you just laid out in some detail. Again, about 10,000 employees we understand will lose their jobs, in addition to those who've already taken early retirement, the folks who took that buyout that we learned about very early on in this administration. At the same time, this restructuring will allow HHS to reduce the number of divisions that it has from 28 down to 15, and then there will be regional offices that we understand will be closed as a result of this effort. And this is all a part of an effort to eliminate, as the president has said, waste in the federal government. If you drill down on some of the agencies that we know well inside HHS, we're talking about CDC, the FDA, NIH. The FDA, as we understand it, will cut about 3,500 employees. They say that this will not affect their ability to review drugs and medical devices and food. It will not impact their inspectors. The CDC looking to reduce their workforce as well by about 1,400 employees once they make some other moves with agencies, sort of moving people around, consolidating some of these offices. And then the NIH is looking to reduce their workforce by about 1,200 people, again, by consolidating some of the functions that already exist in different parts of that rather large agency.